Applicability of supplements FFS ideas to humans and pets. Since the ancient times, healers' interest to improve health with the supplements was addressed mostly to humans, which is obvious. There is few recommendations regarding animals too, but mostly they addressed to feeding of the farm animals in the form of additional exclusion certain grasses from something went wrong. Now it became popular to keep pets at home and consider them as family members. So an advanced pet owner, which tries to do the best for himself, wants to give the same opportunity for their four-legged buddies. In almost each chapter above, we express the dissatisfaction with poor scientific proofs behind many widely used supplements. For pets, the situation even worse. There is one definite advantage of application of supplements in pets. There is no placebo effect, at least on animal side. Dogs and cats does not know what its owner wants to see after application of certain supplements, and if the owner just registered objectives change on their pet's condition, he or she will get answers without influence of placebo exactly on patient. In humans, the situation is more complicated. Of course, specificity of species reaction on supplements can be real. It should be less difference between humans and dogs because both species now approximately on the same level of omnibuseness and then between humans and cats. Cats are much more specialized flesh eaters. Anyway, in most general characteristics, dogs and cats and humans have more in common in their psychology than they have differences in their absence. Now, on the correct data, we have to extrapolate humans' experience into his four-legged and family members. At the same time, any evidence of different reaction of species has to be appreciated very much. Not many, but few such species-specific observations we have. Thus, caffeine and theobromine-rich supplements are good as an activation stuff for humans, but they are toxic for dogs. So coffee, tea, chocolate, and their derivatives should be excluded from their ration. Animals in the wilderness widely use natural herbal medicine for their benefit of their... 1 second. Animals in the wilderness widely use natural herbal medicine for their benefits of their health, physical status, and modulation of their behavior. Their main compass to find which herb they should eat on their or that condition is their instinct. Domesticated animals almost deprive of such possibility. Even more, their appetite practically does not participate in their food choices. It's a big difference compared to humans. More and less appetite determines which products to eat for humans, and thus choice is rather flexible. One day we feel we need to eat meat, and next day we prefer fish or fruits or vegetables. Once made the best choice of dish in the week, we feel like a punishment. Pets have no such possibility. The contemporary owners choose brand of food for their body according to their sense of the benefit and that the pet has to eat their food for years unless vet will recommend switch on different brand or type of food. A pet has no choice. At the same time, we should keep in mind that appetite, food preferences, on one side is instinctive behavior, but on the other side it's a product of learning and training. Influence of education on appetite formation might be good and bad. That is why, on the same case, wrongly educated appetite can cause chronic health problems. In case of unwillingness to independently take nutrition supplements at the choice of the owner, there are only two ways out of coercion and cunning. Coercion means it's to insert supplements deep into mouth and don't let it spit away. Cunning means to hide it in somewhere or something tasty and pleasant. Regarding appetite, there is some Difference between canines and felines. Felines usually more conservative and their food choice, which is understandable. Being strictly fresh eaters, cats may count on more adequate content of nutrition in their prey to the needs of their organism, while dogs, being omnivorous, might more often meet a situation which depends some addition to their food. Even within the same species could be noted different reaction on supplements. As we mentioned above, some cats are more sensitive to valerian while others sensible to catnap. Supplements give us an important opportunity to make better the food for our pets. Of course, for free consumption of necessary supplement dogs are more appropriate, but right choice of supplements, a tasty appearance can solve their difficulty anyway. Of course, in many cases, when vet and their own dog owners are better than pet itself, what kind of chances has to be down to pet's diet pattern, the owner should find a way to convince their body to eat what they think they should. One more difference between humans and pets consists on the arms of supplement usage. People usually know what they want for themselves: longevity, improving their sex drive, being protected from stress, and so on. So besides instinct, on us rationality works too. Humans have right to make their choices. Their pets deprive from those rights. Dogs and cats might think that their alienness is reasonable. They don't care about bills for vet services. They know nothing about risk of infection and gum diseases. Obligation to think about these things lay on their owners. So the owners has the choice supplement for their pet according to options what is good. In some situations, calming supplements should be applied. In others, the preference fall on supplements which improve mobility, etc. From many years of observation as pet vet clinic, Ephraim Gurman noticed that the pets more and more than humans plunging to dental problems. It might be connected with the difference in mouth hygiene. Even pets of responsible owners get teeth cleaned much less than we usually do. We think that a significant role of insufficient oral hygiene belongs to consistency of ready food for pets. Both dry and canned do not provide enough material work for teeth and gum, and soft remains of food stay at cavities too long. We also feel that our dogs will ready food most of the days. It's easy for us, but our dogs once or twice a week got meat with a lot of cartilage. If other owners have to do professional dental cleaning for their dogs at least once or twice per year after 3 years of age, we never had such need because they do have no such a problem till the end of their life. And our attitude that chewable supplements of our dogs' diet. Once in a while, our dogs have bad breath, and herbal tea usually helps with the issue. In comparing pets and humans, we have tea usually help. Comparing pets and humans, we have to mention also problems with the dosage application, both pharmaceutical and supplements. Weight-regulated dosage for dogs and cats should be revised. For instance, if the dog and cat weight can teeth or a tenth of human, it meant that the dosage should not be 1/10 of the human dose, but significantly higher, maybe 30-50% higher than that. Human medicine used to prescribe medicine per person. We already discussed this approach in chapter 18D, when the same medicine should be administered to animal vets, usually recalculated dosage for their drug according to the weight of the animal. Actually, it's not correct because relationship between dosage and body mass is not linear. It might be that a number of targets of the dog in the healthy and light organism is more sane. On the other side, small body animals have significantly higher rate of metabolism, so the fortune of the active ingredients in different sides of organism will be different too.